Chronic diseases are long-lasting health conditions that can affect how we live our lives. These conditions often develop slowly and can last for many years, sometimes even a lifetime. Examples of chronic diseases include heart disease, diabetes, cancer, and arthritis. These conditions are a major health concern around the world, affecting millions of people. One of the most concerning aspects of chronic diseases is their increasing prevalence. More and more people are being diagnosed with these conditions every year. This rise is linked to factors like aging populations, unhealthy lifestyles, and environmental factors. The good news is that many chronic diseases can be prevented or managed effectively with early detection and lifestyle changes. Understanding chronic diseases is the first step towards protecting ourselves and our loved ones. By learning about the risk factors, prevention strategies, and management options, we can take charge of our health and live longer, healthier lives. It's about making informed choices every day that contribute to our overall well-being. This essay will delve deeper into some of the most common chronic diseases, providing information and practical tips to help you stay informed and empowered. Remember, knowledge is power when it comes to your health. Cardiovascular disease, also known as heart disease, affects the heart and blood vessels. It is a leading cause of death worldwide, but the good news is that it is often preventable. High blood pressure, high cholesterol, smoking, and diabetes are significant risk factors for developing this condition. One of the most common forms of cardiovascular disease is coronary artery disease, where plaque builds up inside the arteries that supply blood to the heart. This buildup can lead to chest pain, shortness of breath, and even heart attacks. Another severe form is stroke, which occurs when blood flow to the brain is interrupted. Preventing cardiovascular disease involves adopting heart-healthy habits. This includes eating a balanced diet low in saturated and trans fats, exercising regularly, maintaining a healthy weight, and avoiding smoking. Regular checkups to monitor blood pressure and cholesterol levels are also crucial. Simple lifestyle changes can make a big difference in reducing your risk. Choose lean proteins, whole grains, fruits, and vegetables over processed foods, sugary drinks, and excessive salt. Incorporate at least 30 minutes of moderate-intensity exercise most days of the week. Remember, a healthy heart is vital for a healthy life. Diabetes is a chronic disease that affects how your body uses sugar. Glucose is the main source of energy for our bodies, but in diabetes, the body either doesn't make enough insulin or can't use it effectively. Insulin is a hormone that regulates blood sugar levels. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease where the body doesn't produce insulin. It usually develops in childhood or adolescence and requires lifelong insulin therapy. Type 2 diabetes, the more common type, occurs when the body becomes resistant to insulin or doesn't produce enough. It often develops in adulthood and is linked to lifestyle factors like obesity and physical inactivity. Diabetes management involves keeping blood sugar levels within a healthy range through a combination of medication, diet, and exercise. A healthy diet for diabetes focuses on controlling carbohydrate intake, choosing high-fiber foods, and limiting sugary drinks. Regular physical activity helps improve insulin sensitivity. Living with diabetes requires careful monitoring and management. Regular blood sugar checks, medication adherence, and healthy lifestyle choices are essential for preventing complications like heart disease, nerve damage, and vision problems. Remember, managing diabetes is a marathon, not a sprint, and requires ongoing commitment and support. Cancer is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These abnormal cells can invade and damage nearby tissues and organs. There are many types of cancer, each with its own set of risk factors and treatment options. Some common cancers include lung cancer, breast cancer, colorectal cancer, and prostate cancer. While the exact causes of cancer are complex and vary depending on the type, certain risk factors increase the likelihood of developing the disease. These include smoking, excessive alcohol consumption, unhealthy diet, lack of physical activity, exposure to certain viruses and chemicals, and family history of cancer. Preventing cancer involves reducing exposure to known risk factors. This includes quitting smoking, limiting alcohol intake, maintaining a healthy weight, eating a balanced diet rich in fruits and vegetables, and protecting your skin from the sun. Regular cancer screenings are crucial for early detection, especially for individuals at higher risk. Living with cancer can be challenging, but advancements in treatment and supportive care have significantly improved survival rates and quality of life for many cancer patients. Treatment options vary depending on the type and stage of cancer, and may include surgery, chemotherapy, radiation therapy, and immunotherapy. Remember, a cancer diagnosis is not a death sentence, and there is always hope for recovery and a fulfilling life after cancer. Chronic respiratory diseases affect the lungs and airways, making it difficult to breathe. These conditions are often progressive, meaning they worsen over time. Common chronic respiratory diseases include chronic obstructive pulmonary disease, or COPD, asthma, and cystic fibrosis. COPD, a leading cause of death worldwide, is characterized by airflow limitation and chronic inflammation in the lungs. Smoking is the most significant risk factor for COPD, but exposure to air pollution and certain occupational hazards can also contribute. Asthma, on the other hand, is a chronic inflammatory disease of the airways that causes recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing. Managing chronic respiratory diseases involves reducing exposure to triggers, such as cigarette smoke, air pollution, and allergens. Medications, such as bronchodilators and inhaled corticosteroids, can help open up the airways and reduce inflammation. Pulmonary rehabilitation programs can teach breathing exercises, energy conservation techniques, and provide emotional support. Living with a chronic respiratory disease can be challenging, but with proper management, individuals can maintain a good quality of life. It's important to work closely with your healthcare provider to develop an individualized treatment plan and learn how to manage your condition effectively. Chronic kidney disease, or CKD, occurs when the kidneys are damaged and cannot filter blood as well as healthy kidneys. Waste products can build up in the body, leading to various health problems. Diabetes and high blood pressure are the most common causes of CKD. Early stages of CKD often have no symptoms. As the condition progresses, symptoms may include fatigue, swelling in the legs, ankles, or feet, decreased appetite, nausea, and changes in urination frequency. If left untreated, CKD can lead to kidney failure, requiring dialysis or a kidney transplant. Preventing CKD involves managing underlying conditions like diabetes and high blood pressure. Maintaining a healthy weight, eating a balanced diet low in sodium and phosphorus, quitting smoking, and limiting alcohol intake can also help protect your kidneys. Regular kidney function tests are crucial for early detection, especially for individuals at risk. Managing CKD involves slowing down the progression of the disease and preventing complications. This includes medication to control blood pressure and blood sugar levels, dietary changes, and lifestyle modifications. In advanced stages of CKD, dialysis or a kidney transplant may be necessary. Arthritis is a general term for conditions that affect the joints, causing pain, stiffness, and inflammation. There are over 100 different types of arthritis, with osteoarthritis and rheumatoid arthritis being the most common. Osteoarthritis is a degenerative joint disease that occurs when the cartilage that cushions the joints breaks down over time. Rheumatoid arthritis, on the other hand, is an autoimmune disease where the body's immune system attacks the joints. Symptoms of arthritis can vary depending on the type and severity of the condition. Pain, stiffness, swelling, redness, and warmth in the joints are common symptoms. Arthritis can make it difficult to perform everyday activities, such as walking, dressing, and cooking. While there is no cure for arthritis, various treatments can help manage pain, reduce inflammation, and improve joint function. Medications such as pain relievers, anti-inflammatories, and disease-modifying anti-rheumatic drugs, or DMARDs, can be effective in controlling symptoms. Physical therapy can help maintain joint flexibility and range of motion. Living with arthritis requires adapting to the limitations it imposes. It's important to stay active, maintain a healthy weight, and protect your joints from further damage. Assistive devices, such as canes, walkers, and grab bars, can make everyday tasks easier.